Joe Nardolillo. Originally from Coventry, Rhode Island. I graduated from URI in 2018. I also had a Spanish minor as well throughout my time at URI.
All right, and so 2018, not too long ago. Tell us about your journey after graduation. What did you do?
Yeah, so I was what I thought would be a lifelong Rhode Islander at one point, and then I'd actually done a rotation and was able to study abroad during my time at URI. So I really kind of got a little sense of what else was out there for a while. So after I studied abroad in Spain and did some work globally within the college as well, with some pharmacy service trips, I decided I wanted to get away for a while. So I actually did a 4th-year rotation with the Indian Health Service in North Carolina. And that really sparked me to kind of learn a bit more and want to see what else is out there. So I did my PGY1, my first-year residency with the Indian Health Service with a Native American group out in Albuquerque, New Mexico. And I did some work with the University of New Mexico College of Pharmacy there as well. After that, I decided, I really wanted to do academia and I wanted to go down the path, which is a lot of times now is requiring that 2nd-year residency. So I did a PGY2 in ambulatory care and family medicine at the University of Colorado in Denver. And then after that, I really kind of had my mind open and wanted to see where the opportunities took me. So now I am in my first year as a clinical assistant professor at Wayne State University in Detroit, Michigan. And I have a clinical practice site within the Henry Ford Health System out here.
Wow, so you're currently in Michigan.
Yep, currently in Detroit.
Okay, and what do you teach?
Yeah, so it's a good mix. So my clinical practice site is in an ambulatory care setting. So basically I work in a primary care clinic with 5 providers. I'm basically the medication specialist on the team. So they ask me a bunch of questions, but then I also really help to improve the quality of care we give to patients. So we have collaborative practice agreements where I can actually fully prescribe and co-manage diabetes, high blood pressure, cholesterol, and heart failure for our patients here, as well as kind of the slew of whatever questions you get out of it. So I'll take students, about 8 to 10 students a year on clinical rotations with me, plus pharmacy residents through the health system and such. So that's one portion of my teaching, is that clinical practice. And then the other 50% of my role is actually through the College of Pharmacy. So within the College of Pharmacy, I'll be teaching in the P1 lab, so their first year lab. Basically, for next year to come, they give us a 1 year to kind of get adjusted before we have to fully dive into a bunch of teaching. But I'll be doing the patient care lab, where they basically learn their first set of communication skills, how to counsel for a new prescription or for a refill. So that's what a bulk of my teaching will be done in. And then I also will be coordinating a global health elective. So we have had an established global health elective here, and then they recognize that was an interest of mine. So now I will be co-coordinating that course for the first time in the fall.
Wow, so that sounds like you have quite the handful.
Yeah.
How do you sort of like balance all of that like within a week?
Yeah, so it's definitely interesting. Right now, it's a little odd with COVID and being at home for a while of it, because the college is still closed right now. So doing that part virtually, but I still go into clinic 2.5 days a week. So it's a good mix. I think the number one way in academia, we get judged in 3 or 4 major buckets. So one of those buckets will be teaching. One of those buckets would be scholarship or research. So that's like doing projects and publications and stuff like that. And then one part is also service. So that's for pharmacy organizations, or, if you're doing service on the local level or the national level, whatever that might be. And then honestly, I think the biggest success has been really just trying to intertwine things together. So, say you're doing a research project, you're going to involve a student or resident. So you're going to get a scholarship piece, and you're going to get some of that teaching experience as well, too. If you do a project for a pharmacy organization, you write an article out of that. Really just double dipping as much as you can into these things is the best way to be successful with it. My position is 50-50 split. So I actually have 50% of my salary is paid by the hospital. They pay it to the college, who then pays me. But it does kind of make it like you have 2 full-time bosses in a way. So it's really trying to kind of balance that out, and also setting boundaries and being ambitious and eager to take a lot of great opportunities, but also knowing, when you're stretching yourself too thin.
No, of course, but this seems like, you seem like you've got a hold of it really well.
Yeah, learning
So
still.
before
It's
COVID,
a lifelong kind of marathon. So it's being patient, but also eager at the same time.
yeah, of course. So before COVID, let's say, like run me through a typical day. You know, you wake up, you go to work. What's the first thing you're doing?
Yeah. So I'm still pretty new to the role. I think I'm one of the lucky ones where I actually went right from PGY2 right into a faculty position here. So I've only really known COVID here in my clinic so far, but I can kind of walk you through like what my average time looks like. Clinical practice is actually pretty similar right now to what it will be. So I'm in clinic 2.5 days a week, and that's a little bit flexible based on time of year or whatever teaching I would have as well. And then my college time are things where I'm really dedicated to additional like didactic teaching or like doing evaluations for students, other kind of scholarship meetings, things like that. Those are the other 2.5 days. So like right now I do, Monday afternoons, all day Tuesday, all day Thursday in clinic. And then the rest of that time is sprinkled in with teaching and college time. And my clinical practice is really a good mix of face-to-face and telephonic management of patients. So whether that's, I like to see them for the first time if we can, especially now that a lot of my patients are vaccinated and feeling a bit more comfortable to come into clinic. So we'll do kind of full medication reviews for them. I'll tell them bring in all of your testing supplies, whether that's for your blood sugars or a blood pressure cuff, all your medications. Let's just kind of sit down and take that extra time that pharmacists have as opposed to some of the providers to really go through this and make sure we have a good history before we set a path moving forward. And then from there, I do kind of close follow-up with them in between visits with the providers to either change or adjust medications for all of their disease states and to get them to goals. So really driving the quality number. So bringing somebody from an uncontrolled blood pressure to a controlled blood pressure by managing both their lifestyle and their medications as well, kind of being the medication expert as a pharmacist. And from the practice standpoint, like I mentioned, I'm still getting involved in the college and a lot of the activities, and a lot of that comes with time. But now it could be, whether the students are presenting and they need an evaluator to hop on and kind of, run them through some of their first projects, or working in their courses virtually right now. But we've actually done some really good transitions to get students to a virtual platform. But hopefully in the fall, we'll be in person a bit more.
Yeah, I hope that you get that experience at some point, where you're there all the time. So I feel like I'm interested in clinical as well. I don't know much. I'm still a P2, but I feel like that's sort of the route I want to take. But at what point did you realize that you wanted to do or pursue a career in clinical pharmacy as opposed to other settings?
Yeah, so I think the one thing that I always like to harp on to students too is you can do clinical pharmacy in any role you're really in. I think being even in whether in your community setting, people always think, I have to go community or clinical. But we have a lot of great colleagues throughout the whole country of mine that are working in traditional community pharmacy settings, but doing some really great clinical practice work that's going to help improve the quality of the patient care, whether that's like MTM, medication therapy management, or like kind of collaborative chronic disease state management or acute in an inpatient setting. So there really are a whole bunch of opportunities to seize that depending on where you go. I think for me, my path, I changed a million times. I think I was really fortunate at URI where I got a really diverse set of opportunities. I had done a lot, both in Rhode Island and like I mentioned externally, I was able to do some trips to Jamaica with the college. I went to Guatemala with one of our faculty members. I did the rotation in North Carolina in the Cherokee Indian Reservation out there. So I think all of those opportunities is really where I started to say like, wow, I want to kind of expand my horizons a bit. I kind of thought I would maybe do either like a compounding community setting, something like that. And I think my first rotation at Rhode Island Primary Care was probably my first moment. And that was my first like June block that I had where I was like, I didn't even know this existed. And it really kind of shaped my life of working side by side with providers and pharmacists with a diverse set of experiences in clinic and really having that time in a practice setting to be able to help patients manage their chronic diseases, make sure they understand their medications, really just kind of dive in that teaching expert. And I think those preceptors that I had there, those faculty members that I've worked with throughout my time as a P4 are really what I think shaped me to kind of pull my way through to now. So I think it was being focused and kind of knowing roughly what I wanted, but also being willing and learning what you like on a rotation as much as what you don't like. I think that was another big thing for me where there's sometimes where there's settings where people love what they do, but you're like, this might not be my cup of tea. So I think that also helps shape you a bit.
Yeah, because you can rule that one out and be like, no.
Exactly. Yeah. I always tell every student there's no such thing as a bad 6-week rotations. You can get something and find your passion or find that you're not as interested in something in that period of time.
Yeah, I remember you told me that too, like last week, and I remember that well. So yeah, would you say that the most rewarding part of your job is sort of just that one-on-one communication with the patient and when you can get their blood pressure down or their glucose levels down?
Yeah, I think it's twofold. I think from a practice perspective, I love the patient. I love the ability to take the time and really sit through and dive into the patients because providers are busy. We're the healthcare model right now, and they have 20-minute visits to see these patients and kind of get them in and out. And there's only so much you can do in one of those kind of visits. Whereas, although we aren't able to bill for a lot of the pharmacy services we do, I think it does provide like less of that time crunch standpoint because we do have some flexibility and some patients do require that much time. For me, those patients that come in and say like, wow, nobody's ever told me that before, or I feel like I understand my disease more than I ever have in the last 10 years that I've had it. I think for me, those are the most rewarding. And when people genuinely do appreciate, and when they look forward to that call, if I say, hey, I'm going to call Monday at 1 o'clock, like they're waiting on the phone, and if I don't call them by 1:05, they're calling me. So that to me tells me they're really invested in this, and we've got them more attuned to their care than they probably were beforehand. And then from a student standpoint, I just love the student that feels that click, and they feel like they get it. So, whether that's watching them observe these interactions, I think the best part about rotations for me is, you have that classroom knowledge, you have that ability of disease states. We know we're knowledgeable, we know we study well, we know the backbone of it, but it's watching students grow the communication piece. And I think we all can talk in a way, but then we also all get a little awkward sometimes. And whether it's the student who, fumbles a little bit in the beginning and then really is leading a visit to start to front in the whole kind of span of the visit over time, I think is really what gets me really excited about my job and seeing that growth of them throughout. And then seeing them to go on to new things. We just had residency match day the other day, and a couple of students I had with me before, and watching them go on to their next steps is really what I really get excited about, and then keep doing it again next year.
Yeah, I was having secondhand excitement just looking at everyone's posts when
Yeah.
they got matched. Um, I think that's cool when you get to see their progress when you first come in and then
Yeah.
towards the end when they leave and the growth that they've
And
gone through.
especially because I've kind of been to a couple different institutions now, like there's students that I taught in their P2 class when I was at New Mexico at the College of Pharmacy there that I now see matching. There's students that I worked with when I was at Colorado, and then now my Wayne State students here. I think really kind of seeing all those different paths and building those connections, and now getting to them to all see their next steps is really great.
Mhm. And even talking to the patient, I feel like within community pharmacy too, with the number of scripts they fill per hour or day, there's no time to really counsel. And we
Yeah.
learned all of that in our OSCEs, like the three main questions and all that. You don't really get time for that, but I feel like
Yeah.
you do. You have that.
Yeah, and I think it's just a different level. There's sometimes where I think our community pharmacists are the ones that, they're the first people they can get to. So they make do with what they can. And I think a lot of times, they'll plant the seed and we'll like ask them, hey, like this is what you need to know. Or I get a lot of people who actually say like telling their patients to ask specific questions to their provider, which I think is great. Like, hey, even if they don't have time to sit down and go through all of them, like this doesn't look too right, or hey, I don't think you need a little more teaching on this, and doing what you can in a practice setting, but then also being able to work kind of simultaneously on both sides, on the pharmacy side as well as the clinical inpatient in practice side that I'm in, like in an actual office.
So who do you collaborate with the most? I know you probably like other providers, other faculty, but how big is teamwork in your job?
Yeah, so we have a pretty cool setting here. So I'm actually one of 5 faculty that all are at my clinical practice site. So there's 2 of us in primary care, ambulatory care. We actually started together. So we collaborate a bunch. We're in 2 different clinics, but we basically do the same role there. We have another one who works in a pulmonary clinic that I collaborate with often, and then 2 infectious disease faculty members. So that's basically from the Wayne State College of Pharmacy, there's 5 of us sprinkled throughout the health system. I also have a lot of other pharmacists that do my role, but they're full-time clinical practice people as well. So I would say those are individuals I'm doing projects with, quality improvement projects, research, very often. We actually also, as a collective here, we take 12 students on what we call a longitudinal API. So basically students apply almost like a mini residency. They apply in their 3rd year, they come here, and then they're with us for they do 7 blocks here. So they're with us for 7 blocks throughout their time, which is really interesting. And then that gives us some time to do projects and be able to follow through. And then we get to actually mentor them all throughout their year, even if we're not on rotation with us specifically at that time. So I would say I collaborate from an academic standpoint with a lot of those individuals. And then from a day-to-day practice standpoint, yeah, so I have 5 providers that work in my clinic. So they are seeing, they see between 20, 25 patients a day, just with 20-minute visits. Whereas, I do about 12 to 13 patients a day, depending on what it is, plus filling in some other calls and stuff in between that. So, if I have a question, I can run right over to the providers, go ask them. If I need to refer or ask questions to a specialist, I can send them in the electronic health record. But I think that's been also the big kind of arc of all of this is I started my clinic. They didn't even know what my role was. They didn't know like how a pharmacist really fit into this clinical practice setting. They hadn't really had somebody working on kind of quality improvement and pushing under a collaborative agreement like the way that we work. So it was definitely me educating them in a way about how we can best be used and, waiting for them to refer and a little kind of hanging out in the beginning and trying to get it working. But it took some initiative to really just even say, hey, I know you saw all these patients yesterday, their blood pressure was high. Do you mind if I follow up with them? Being a little proactive from there. And now they just come into me all the time and they like come over, they'll like ask me questions, send me a message in the electronic health record, pop in the office, leave me a sticky note, all of the things, and really see me as a part of the team now, which is great.
Yeah, cool. Out of all of those providers, would you say you're like the youngest? I feel like you got to this position so quickly.
Yeah, I would say I'm probably the youngest in the College of Pharmacy department, and definitely in my clinical practice office. So it's definitely unique, and I think it's really leveraging. And I feel like we're in a really great situation at URI, and I always harp on students to this that I talk to back from URI, having the 0-6 structure that we have very often at URI. We get a lot done in a short period of time. By the time many of us coming right out of high school and then going on to finish your degree, by the time you're 23-ish, somewhere around there. I mean, I did 2 years of residency at 23, after 23, and then now I'm in my role here. And there's people where they're just in like the middle of their pharmacy school time at the age I am still now, like whether it's friends from Kappa Psi that I have, or I mean, many people are now where they do a 4-year degree, they take maybe a year off and work for a little while, then they go back and do 4 years of pharmacy, then they go back and do 2 years of practice. So I think we're in a very unique and exciting position at URI once we graduate to be able to take those risks, take that 1 year of residency where you might not be working as much, take that fellowship, take that job that might not pay you that highest amount, but gives you some more flexibility to do some things that you might not have been able to do otherwise. So I think it's the biggest blessing that we have in the position that we had from URI that really has sprungboard me to be in the position I am now, and now have so much time and flexibility in my career and be able to take risks like move to New Mexico that I never thought I would do in my life because I was still young and I had a lot of opportunity.
Yeah, I mean, that's why I joined URI. That's
Yeah.
why a lot of people came here, because of the 0-6, like why not save those 2 years?
Yeah.
And so if for someone who's watching right now, if they want to go exactly in your position, do you feel like they need a particular skill set or some sort of experiences to get to where you are?
Yeah, I mean, I think the biggest reason I've got to where I have been was really the ability to kind of communicate with people, whether that's, the ability to communicate about where you want to go and express your interest on an interview and why you would be a good fit there. But then also whether that's communicating with a patient. And I think that would really help me being able to go with students. And I also think it's really tied to the fact of, communicating things to preceptors. When I was in residency, there was things that I thought I needed to work on, and being able to speak up about yourself, and you're your own guiding path through all this, I think. So the more you're attuned to yourself and know what your strengths are, and also not being afraid to say what your weaknesses are, and then seeking opportunities to overcome those weaknesses. I think that has been by far, I use the example of my PGY2. I was not great at research. I didn't really have a great research kind of backbone. My PGY1 was much more clinically focused in practice. So I said, I want to go to a PGY2 residency program that is really great at research. That's where I said, I went into my interview, I said, that's not my best skill. I know you all are very good at it here, but I'm coming here to look for that opportunity. I have somewhat of an understanding, but I want to build on that here. So I think people really appreciate and acknowledge when you're humble enough to be able to say, I think I need work still in this area, and not just saying it, but actually taking the steps to do something about it.
Right. Yeah. And as students, I feel like we are so stressed about, the residency interview process or all of that. But I guess one thing that we can look forward to afterwards is the work-life balance, right? Because as students, we are working from the second we wake up to when we go to sleep. Does that get better? Like, are you at a 9 to 5? Do you have some time afterwards?
So academia is definitely a little bit different. I mean, we have a lot more flexibility in terms of like the time of things that we do, but I would say it's definitely more than a 40-hour work week very often. Because it ebbs and flows. There's those times, and as students, there's those times of year where you're running around like crazy, and it might be I'm coordinating a course and I have my practice site ramps up. I have patients scheduled. I have a student with me that I have to kind of balance at that same time. I might have a resident with me, a longitudinal project. I, have all of these things that kind of mesh together. I think making time to make work-life balance is important. I think I got a dog, I got a puppy after I started my job here and moved because it was going to make me come home. That's the way I looked at it. It was going to make me keep that balance and have something else to hold me accountable, which is great. Because, even if that's, I leave and finish work at 5 and I go to the dog park and I open my laptop for a little while later the night, at least I'm having that balance and being able to break it up. But I think, you'll always be as busy as you want to be. And there's even among our students, there's always that wide range. And I was always that student that was nonstop, and sometimes probably didn't take care of myself enough during those times because I was attending this event and doing this and doing that within the college. And I wouldn't have changed those experiences for the world because I do think being involved at URI and building those connections with other students, with other faculty, is really what helped me shape me to who I am now. And I wouldn't be in this position I am without it. But I do think it is very important, both for students and if you're a resident and as a faculty member, to build in that good personal time to be able to de-stress. Because, if you're going all the time, go, you're not really giving everything your all. So being able to kind of give yourself and care about yourself in a way, and then bring that back to your work at the same time.
No, I agree. Yeah, I mean, I'm definitely busy all the time, but it's mostly my fault. Like I've took on
Yeah.
a lot of that for myself. But like you said, I wouldn't change that for the world.
No.
I love everything I do.
Yeah, I mean, whether it was like I worked in a lot of the recruitment stuff at URI when I was in college there, I was heavily involved in Kappa Psi, and I'm still involved in Kappa Psi now. And even on that part of my faculty role and part of the work I get to do, and that counts into my job now. So it really is a really kind of full circle to see some of the stuff I was doing as a student. And now because I was mindful and kept that in kind of connections going through even as my resident years, now that I'm in this faculty role, I have a lot of great opportunities still and connections to already build upon.
Okay, so could you just talk to us real quick about what it means to be board certified?
Yeah.
Just for the people who don't know, what's the board certification process like, and is there an importance or significance behind that?
Yeah, so board certification is definitely something that's ramped up kind of within the years and years past. But I actually just got my board certification in ambulatory care this past fall. I took the exam. So board certification, basically, it's a way to try to kind of homogenize some of the things that we're doing as pharmacists and creating almost like a stamp of approval that like, even though we're working in different ways and doing different things, we're kind of all on that same page in a way. I think in ambulatory care in particular, which is really working in primary care, working side by side, there's a million and one different formats about how that could go. Whether that means you're consulting providers, whether you're being more proactive and doing outreach, whether you're reviewing patients kind of out of the context of a visit, there's a whole bunch of different ways to do it. And I think, the different practices I've been in has told me that more and more and seeing that firsthand. So this is a way to try to kind of create it on the same page. Basically, if you go, there's a couple ways to do it. If you go the residency route basically is like for, depending on what exam you do a 1 year or 2 years of residency, and then like with practice as well. And basically saying that you're doing clinical practice 50% of the time, which you clearly are in a residency. And then you take an exam, very large exam. I mean, it was lots of studying beforehand, basically covering the whole wide array of clinical topics. So like I said, mine was ambulatory care, but whether you did oncology or if you did if pediatrics, if critical care, kind of whatever setting, they have a lot of those specialties even more so. So all of the exams are kind of tailored to that and written by pharmacy peers who have that experience and kind of know what kinds of things you should be able to do if we're going to put this stamp of approval on you. So I think every exam's a little different and everybody's path to get there is a little different. I mean, I have some colleagues who didn't do a residency and then just practice for 5 years, which also, I think it's 5 years, would qualify you to sit for the exam as well. So I think, we think of a lot of things in pharmacy as very like sequential. You get out, you want to do a residency or do a fellowship, then you go on and do another thing. And although I had a semi-traditional-ish path, I would say my PGY1 was a little different being with the Indian Health Service. But I think, the path I took is just one of the many to get to where I am. I mean, even I look in my colleagues in the department at the College of Pharmacy, everybody got there in a different path. And even in those in the practice site, there's 7 of us who work in my role doing primary care, ambulatory care. Many to most of us are all board certified, and everybody kind of got that from a different setting, whether that was they did a pharmacotherapy PGY1 and PGY2, or if they did inpatient after a regular PGY1 and then transitioned to a outpatient role. So there are a bunch of different paths to get to there and get to board certification as well.
And that's why you're here. Like, we want to showcase that even within the traditional path, you can still take non-traditional routes and have your own experience out of it. And yeah, so clinical pharmacy might seem like a traditional path to many, but even all the clinical pharmacists out there have had their own different experiences and
Yeah.
paths that they took.
And even if it kind of looks the same, I think, whether that's you traveling to a new area or, even in the country, there's different ways that people practice very, very differently amongst each other, based on whether that's state laws and regulations or just kind of the culture of the different areas and how pharmacists and providers have relationships within each other. And I think that has been one of the things that I really enjoyed most. My site in New Mexico was a federal site, so that they practice even different there. And then I was at a large academic medical center at the University of Colorado. And then now even here, I kind of have that hybrid. I have a large health system, but a medium-sized college of pharmacy at Wayne State that's pretty similar to URI's, I would actually say. So it's a really good balance. And I think, for anybody who is looking to kind of go down those different paths, you're going to pick things up along the way. Even within 1 year of rotations, you pick up things for preceptors. I think I even joke about, when I've worked with different people, like I will mimic how people ask certain questions. I think that's the role of being a student or a resident or on some of those training paths is, I always call it the tools in the toolbox. You kind of pick little tools along the way that people use, and you're not going to mimic any one person exactly, but you're going to use it and develop it into your own. And to me, that's one of the best reasons to go out and potentially expand your horizons a bit, go in a role, apply for a program, apply for a job that you otherwise wouldn't see yourself doing. Is you're only going to gain something and you're only going to gain a new skill. And the more you diversify yourself, the more experiences you're going to get. And I think the better prepared you are to work in a multitude of roles.
Yeah, we're definitely a sponge on rotations and just take in everything we can get.
Exactly.
How do you feel like URI prepared you for where you are right now? Do you feel like it was a good foundation, a good strong support? Yep.
Yeah, I mean, I have talked about URI in a positive manner in every step of my way. And I like to think that hopefully I was a good, kind of tucked in New England up there and then going out a bit. I gave a lot of people a good first impression of URI because, like going out west, many people don't have that experience. But I think for me, URI made me who I am today. I think I had the ability to be so involved with my other colleagues and whether that now people that are my colleagues who were my professors back then, in many, whether that was doing a project or working on a pharmacy organization. Like I said, I was very heavily involved in Kappa Psi as one of the many organizations, and I'm still involved in that today. I worked with a lot of the recruitment stuff with Denise Kerensky and a lot of the other faculty and administration as well. And I think that really is what helped me get there. And honestly, I still talk to many of my professors that I have. Dr. Charpentier is still one of a great colleagues for me. Dr. Matt LaCroix is another one. I think these people that I can still turn to now that I'm in a similar role to that they were. And I still reach out to those individuals and I still kind of lean on them because I had such a great experience during my time there. And I think these people pushed me. They were people that pushed me outside of my comfort zone, helped me kind of realize some of my own strengths and weaknesses from there. And I think that is what really even makes me now want to come and do a talk like this. I think really acknowledging that it really is such a community-based setting. You really will have that ability to work with these people side by side. But I do think it's up to the student to be ambitious. You know, it's up to the student to want to seek those opportunities, to seek those mentorship abilities, to seek those things that are going to set you apart for if you do go outside somewhere different, that's going to make you say, wow, this person was ambitious, achieved a lot of great things, but also has some other great skills they picked up along the way. And I'm very thankful for that opportunity and those abilities that I've gotten from URI that now I think has cultivated, and kind of, I had a good foundation and it got shaped a little bit as I went to each new place. And I think I'm really happy to where I stand, and that solid foundation kind of helped me to get here now.
Yeah, I definitely agree. You couldn't have said that better. URI has given us the best foundation to the point where we are so prepared to go out there and do things like what you're doing, which is pretty cool.
Yeah.
So how do you feel like your role is going to evolve in the future? Do you feel like clinical pharmacy has like a scope of changing later?
Yeah, I mean, I think my role in particular, kind of in both settings, is going to change drastically. I think as you know, what I'm doing in my primary care clinic is actually has happened because we had a lot of individuals already doing this job and they were successful with it. So we kind of expanded. I'm part of the expansion piece that had happened from a few individuals who were doing it before. Even more so than that, I think a role of like some of my research as well will be like looking and see, you know, evaluating, now that we've been doing this for a while, what is the actual impact we're having? You know, right now pharmacists can't bill for our services. So that meaning, you know, we can bill for some things. It's just not nearly as much as it would be for like a regular provider visit because we're not recognized as providers. But we do make money in other ways. So, you know, we have a lot of contracts that say if you have a certain number of patients with controlled blood pressure, we'll give the health system X amount of dollars. Or, you know, by controlling blood pressure, we've prevented X number of strokes. And what does that turn into $1? So I'm really excited to work on that part of it now to help show the value of pharmacists, even if we can't directly bill at this time. Hopefully we will be able to. But how are we making money for the system, and then kind of helping and working on that expansion from that standpoint. And then I think from a College of Pharmacy standpoint, when I'm in that role, I think that's going to continue to change more and more. I think, you know, we have a clinical doctorate degree, and I think that's where training students to that ability and training them to be prepared for a wide variety of settings and a kind of ever-changing pharmacy landscape, you know, whether that's whatever the students want to do, or whatever new roles are emerging as well, whatever previous roles were changing. I think we have a responsibility as a faculty to help students be prepared for this. So I think that's where I'm really excited, and also being open to where the things come along the way. I think, you know, knowing that I joke, and as an ambulatory care, we're, you know, specialized generalists. So I can work in heart failure, diabetes, blood pressure, even if anything else new came along the way. And I think the same will happen for teaching or my research. You know, I'm interested in a lot of those other things. And I think whether it's somebody that's coordinating a course and says, hey, I have this one lecture that you might be interested in. And then I take it and it's a little outside of my normal wheelhouse, but then becomes a great passion and can expand and turn into research projects, collaboration, et cetera. And I think that's what I really like about academia. For me, I mean, if you look at even some of our URI professors, and hopefully my role in the future too at Wayne State, is really that these things change based on what your interests are, and you have that flexibility, you have that ability to research new things and work on new practice. Whether that's where if something's kind of new at the times, like look at how many people are now working on COVID things that they never anticipated to do before. So I really enjoy academia, and I think that's where a lot of people can find interest in it. You know, it's much more than just standing in front of a classroom and lecturing in a way, but it really does allow you to kind of work and fill your own interests as well as the needs of the pharmacy community or your college or anything that's also open.
Yeah, I think that's been my biggest takeaway from this is that I never was particularly interested in academia, but I think from now you can tell that like the biggest advice that you could probably give students is just to be open to anything and just
Yeah.
take whatever comes your way.
Yeah. Like I said, people always ask me, especially when I was resident, like, where do you think you're going to end up? Where do you think you're going to do? And I go, I never thought I would be moving to New Mexico in my life. If you had ever asked me anytime before residency, anytime before like my P4 year, but that's really where I sparked my interest for it. And I think, you know, I luckily was that I had some good steps along the way and built some of those solid foundations at URI that allowed me to kind of springboard my opportunities, but also just needed to be willing to kind of take the dive. So that's what I I always tell students, if they're debating between, somewhere closer because you think you're just afraid to take the leap, obviously people have different situations and if they can or they can't do that. But I think that any experience, even if it's your time of student, going to a conference that might be on the other side of the country just to do it, the networking you have, present a poster, do a research project, work in the local URI area and share that information elsewhere. I think that's one thing we've really been able and really fortunate to do out of COVID is to, students who otherwise might not have traveled to a conference can now present at one virtually and can do things like that and network with other people at other colleges and pharmacies. And I think, building your network and not being afraid to they go hand in hand, start a conversation with somebody. You have an interest or you read it, listen to a podcast that was interesting, or you knew that somebody was doing, or you read a great article that was interesting to you, send them an email. I think that could be the start of an interest of yours and build a professional relationship that could be totally skyrocket your career.
And I think students are going to now watch this and reach out to you and email you to try
That's
to
always welcome. I have a lot of, friends from when I was at URI, like I said, I wasn't there too long ago, that are still there that I talk to pretty regularly. And now that group's kind of fizzling out, I am more than able and willing to answer any questions that anybody has.
Yeah, well, thank you so much. I feel like this has been so informative. I've learned so much about what you do, but also what's out there for us. And I feel like you have definitely taught us a lot. So thank you so much for that. And do you have any last words, last piece of advice to give students?
No, like I said, I think, thank you, Sonica, Dr. Estes, for everybody for reaching out to do this. It's just that you will have more opportunity than you can ever imagine at URI. And I think really being mindful that, you're the guider of your ship. You're going to write your own career path. There's opportunities out there. You just got to be strategic about what you grab. But be ambitious, be fearless, be able to tackle the things that you're interested in, because you will not regret it. And, being rewarding in your career goes hand in hand with being rewarding in life. And I think, we have a great platform for that at URI. So don't be afraid to seize it.
Of course, and we are proud to have successful alumni like you who can give us advice about our paths. So yeah, thank you so much. Have a great rest of your Monday.
Thank you.
Thank you. Bye.
Yeah.